Are we live already? Okay. All right, good evening everyone and welcome to our live today. As usual, we've already said that in these lives I don't bring a topic of my own. You people just ask any questions of your choice and then we answer you. Thank you so much for following Ask Dr. UTHUMAN YouTube channel and also Ask Dr. UTHUMAN on TikTok. So today we are going to have 1 hour of our live and I ask you to be very brief with your questions. Let your question be very brief and straight to the point so that I can serve everyone. Call everyone, let them come near so that we can start immediately. And right away, let's start with questions here on the YouTube. Who has asked today? Who is number one to ask? Everyone is Destiny Child is hello, hello. Yes, hello, how are you? Owolabi Omouni, he's saying hello, hope you're doing well. Please, can I ask a question? Please go on and ask your question. Tamara, good evening. Everyone is still just greeting me. Yeah. I think hi to everyone. So now it's now business. Ask questions. I think greetings are done. Okay, so we have Sai Baba Binshi saying how this English here. Hello, how I found my ovulation day sometime. Period time gap is 28 and in 3 months, then 30 days continue. Seriously, Sai Baba Bishat, I am not understanding your question. Be clear with your question. The English is not Englishing very well. Because you please repeat your question. Sai Baba Bisht. Repeat your question. I don't get it clearly. Then we have Sandy Mumba is saying, good evening, doctor. May God bless you. Thank you. Bless you too. Mariam Abdallah, hi. I'm pregnant by only 1 month, but always my back paining me. All right. Back pain during pregnancy. I think in most cases it's normal. It's normal for some women to feel that back pain during pregnancy. However, when the pain is severe, if it's too much pain you're feeling when you're pregnant, then you may be having things like a UTI, you may be having things like a PID, or even a kidney disease. So if the pain is too much and it is persisting, and by the way, pain at 1 month is unusual, okay? Pain at 1 month is unusual, and therefore you can suspect what we call, you may be entering into a miscarriage. It is one of the signs of, actually, early signs of a miscarriage. That is back pain, then which can be followed by some bleeding. Therefore, you should be very cautious when you have that abdominal pain. But mild back pain, some mild back pain may be, we can say abnormally normal. Okay, we can say it's abnormally normal. But if the pain is severe or if it's moderate to severe, then it may be pathological. Actually, even people with syphilis, secondary syphilis, they can receive, they can have back pain. Therefore, if the back pain is too much, then you need to seek for medical attention. You test and find out what is causing that. But if it's some little mild back pain, then you can leave it. It may be normal or what we call the abnormal normal. Another question, this one is saying, Janet Mwenda is saying, I have 28-day cycle and I was diagnosed with polycystic ovarian syndrome. Because what med can I take for me to conceive? Now, if you were diagnosed with polycystic ovarian syndrome, there are medicines you're supposed to take which can be used to treat polycystic ovarian syndrome. Medicines like PCOS, medicines like Hormonal, and several other medicines can be used. So one, you need to be on these drugs, on polycystic ovarian syndrome drugs, first of all. That is number one. Number two, there are women, we also give hypoglycemics, all drugs, the same drugs they use to treat high blood sugar levels, all diabetes. We can use some of those drugs to treat this polycystic ovarian syndrome. Then also, at times, there are times we reach and we give you clomiphene, all letrozole, all tamoxifen, all drugs of that kind if we want to get pregnant. So that is basically how I would, this is called who? Janet Mwenda, that's how I would advise you. You're supposed to be on the other drugs, the specific ones for polycystic ovarian syndrome. Then you're also supposed to be put on fertility drugs, and sometimes you can be put on diabetic drugs. Now, what do I advise there? There I would advise that you go to the hospital, check with the doctor, and plan for this treatment very well, okay? You plan for the treatment very well. Otherwise, if I just tell you right now that go and take such and such medications, I would be wrong. You need to have some few tests done, okay? Some few tests done. Yes, you've diagnosed with polycystic ovarian syndrome. Now you need to do a little bit more tests like the random blood sugar levels, okay? Then the fertility hormonal assay, especially on LH and FSH, and then you take these medicines, you can conceive. By the way, let me tell you guys, most people think when you have polycystic ovarian syndrome, you cannot conceive. No, people can conceive even with polycystic ovarian syndrome. So it's very, very possible. Then another question here on our YouTube, someone is saying, Sandy Mumba is saying, Doctor, what causes belly button pain towards ovulation and towards menses? I have fibroids. You see, pains during menses, we said they're as a result of hormonal fluctuations, okay? As a result of hormonal fluctuations, and also some people feel that pain as a result of hormonal fluctuations, but these ones specifically, belly button pains, in most cases are as a result of indigestion. Okay, indigestion. When you eat food and it is not digested very well, I think you know the process of digestion. If food is not well digested, it can cause those what we call the belly bottom pains. When you have constipation, and actually some women when they are pregnant, but now in this case you're talking about menstruation and ovulation, it means you're not pregnant, then it may be as a result of indigestion or constipation. But don't forget that those pains can also be as a result of the hormonal fluctuations. Sometimes when you have pain, you may not be able to substantiate that pain, whether it is specifically in the lower abdomen or the other parts of the abdomen. But belly, if it's what you're asking, belly button pains are as a result of constipation, indigestion, and pregnancy. Now for menstruation, to me, I may think it is as a result of hormonal fluctuations. And also remember that because of hormonal fluctuations, some women receive constipation during menstruation, okay? Another question on YouTube here, someone is saying, Neri Shamitaba. Neri Shamitaba, how are you? Where are you? This name is it is a serious name. Neri Shamitaba. Hello, Doc, can vitiligo on the vagina be treated? Can I get my dark skin back? Whether vitiligo, whether it's on the V or it's in any other area, it still remains vitiligo. Now, I would not indulge myself so much into the treatment of vitiligo. I would ask you to check on dermatologists. But with what I know, vitiligo may not be curable. In most cases, sometimes they just give you medicines to relieve a few pains and so on, and ulcerations and so on, if maybe. But in most cases, it may not be curable. But I would not so much indulge into such questions. This is a question concerning dermatology, and I'm not a dermatologist. I just have a small hint on that. So I would request you to ask a dermatologist. Mainly, guys ask me about fertility questions and reproductive health questions. But I would request you to check on a dermatologist. I don't know which country you're in. If I knew the country where you are, I would direct you or recommend a dermatologist for you. Then this one is saying, Sai Baba, how I find my ovulation period time? Okay, this is the person who was asking the other question. Let's go back to that question, saying, how do I find my ovulation? Okay, sometime period time is 28 in 3 months and 30 days. Okay, now we've gotten you, Sai Baba. All right, so you want to know your ovulation day, and you're saying sometimes your periods are, the length of your menstrual cycle is 30, and at times it is 28. So if we said if your cycle changes, like if you have an irregular menstrual cycle, we encourage you to use the shortest, okay? The shortest out of all that. Therefore, what we are going to use, the shortest cycle, and that is 28 days. So let's use the 28 days cycle to calculate your ovulation day. Let's calculate the ovulation day using a 28 days cycle. What's this? So a 28 days cycle. Okay. A 28 days cycle. So a 28 days cycle. How can we find the ovulation? So someone with a 28 days cycle, this is what we are going to do, okay? This is what we are going to do. We are going to say 28 minus 18. Which answer do we get here? Someone give us an answer there. 28, okay, yeah, someone is saying we get 10. Okay, so we get 10. Then 10 plus 4, we get 14. Okay, I've given this myself. So 14 plus 5, what do we get? Someone give me an answer here. Yes, 19. Okay, so Miss Sai Baba, if you have a 28 day cycle, it means that your ovulation day is on the 14th day. Okay, so this is your ovulation day. 14th day is your ovulation day. This is your ovulation day, 14th day. But however, you are fertile from day 10 up to day 19. Therefore, from day 10 up to day 19, all these days you can get pregnant in those days. And the days you cannot conceive, you cannot get pregnant are from day 1 up to day 9, and then day 20 up to day 28, up to until you see your periods again. So these days you can't get pregnant, but from 10th up to the 19th day you can conceive. And just understand that on the 14th day, that's when you have very higher chances of conceiving. Therefore, if you want to conceive, this is the day you can give yourself. Okay, so we got another question. And this is okay, Janet Mwenda. Okay, so where is the question? Okay, Olabi Omoumi is saying, I have been trying to conceive and the doctor confirmed nothing is wrong with me. What can I do? You see, I've always told you people, okay, that you cannot tell me that I am not able to conceive 1 month, 2 months, 6 months down the road, 12 months, that is a year, 2 years, you're not conceiving, and the doctor is saying there is nothing wrong. Let me tell you, that statement, nothing wrong, means there is something that has not been done. Usually, when someone fails to conceive, there is automatically there is something wrong. There is something wrong somewhere. I usually tell you that the problem is that you've not done all the tests. The woman's reproductive system, I think next live I should just come up and teach the female reproductive system. The female reproductive system is so complex. The female reproductive system is so complex to an extent that for someone to conceive, for someone to get pregnant, for someone to get menstruation, for someone to get ovulation, There is a lot that comes into play. There is a lot that has to come into play. The structure, the structure of the reproductive system must be normal. Which structure are we talking about? We are talking about the vulva, the V and V, the vulva and the vagina. They are supposed to be normal, no masses. Okay? No infections there. Everything is okay, no scarring. You come to the cervix now. Okay? You come to the cervix. How is the cervix? Is it normal? Is there any mass, a swelling on the cervix? All those things must be normal. You come to the body of the uterus, what we call the womb. How is it? Isn't it slippery? Doesn't it have fibroids? Doesn't it have any masses, any cysts around there? Okay? So we have a lot of things that come into play. How are the fluids there? Don't we have so much thickness in the endometrium, in the womb? There is no PID there. Is everything okay? Then from there we go to the tubes. How are the fallopian tubes? No PID, no adhesions, no scarring, no blockade. Is everything normal in the fallopian tube? Then if it's normal, we go to the ovaries. We don't have polycystic ovarian syndrome. Do you have the ova? Is there an ovary? Don't you have a mass, an ovarian cyst? Don't you have a complex mass there, a hemorrhagic cyst, things like that? Okay? Don't you have are the ovaries having ova? Isn't the ovary infected? Their condition is called uveitis. Okay? So is everything normal as far as that system is concerned? That is now structure. We are looking at what is causing infertility, what is causing this woman failure to conceive. So then from there, if the structure is okay, structurally you're fine. Now we go to the ingredients of the structure formula. What are the ingredients of the structure formula? Because you see, a female system, a woman's system is like a motor vehicle. It's like a motor vehicle. What we have seen, or what we've talked about, is the body of the vehicle. Because when you tell your mechanic that my vehicle is failing to move, is failing to take off, they're going to first look at that. That is the body. Okay? That is the body, the structure of the reproductive system. That's what we are going to look at firstly. Okay? First, we are going to look at that. Now, after the structure, we entered inside. We look, do you have the fuel? Is the oil okay? Have you used the dipstick? Is the oil levels? Are they normal? Are they normal levels? All your dipstick is down this side, where there is that angle there. I don't know how it's called. All it's below the minimum level. Is the oil okay? So we come to the fuel tank. Do you have gas? All the engine is failing to take off because there is no gas. So we have to investigate that. I think I want you to, when you're looking at the problems, especially problems of infertility, I want you to look at them as if, assume you have a vehicle and your vehicle is faulty. How are you going to find out what is causing, what is happening with your vehicle? Is exactly how you find out what is happening with your body system if you're not conceiving. So what's fuel? The fuel we are talking about are the hormones. How are the hormones? The primary fertility hormones, how are they? Are they normal? Are they in normal levels? We must look at that. If they are in normal levels, there are also other secondary fertility hormones. The secondary fertility hormones. Because the primary, we have FSH, LH, AMH, estradiol, and progesterone, prolactin. Those are primary. But there are also secondary ones. Secondary ones, we are talking about the likes of TSH. Okay? The likes of TSH, the likes of T1, T2, T3, all those ones, are they normal? So when you tell me that my doctor said everything is normal, did you do all those tests or did you check that system wholesomely? Or something little was done? So that's why I'm saying that it is not possible for someone to fail to conceive when everything is okay. Have you checked your husband? Are the sperms normal? Are they of a normal count? Do they have a good motility? How is the quality? Or they were destroyed by steam bath. Okay? So you have to investigate all that if you are to tell us that really nothing is wrong. Let's go to another question. This one is saying, Doctor, what causes, I talked about that. Okay, okay. Tamara Mukandawire, which country are you? Where are you? Tamara Mukandawire is saying, Doc, when I'm cleaning my vagina, I feel the uterus is not on the point. I feel it to my right side. Can it be operated? I don't get you. Doc, when I'm cleaning my vagina, I feel the uterus is not on the point. I feel it to my right side. Can it be operated? Of course, I think you're talking about a prolapse, vaginal prolapse. I mean uterine prolapse. Yes, it can be operated, it can be put back. There is a colposcopy. They can put it back. Yes, it can be operated if it's pushing down, and that is called prolapse, uterine prolapse. It can be put back in position. Saireta Ashan is saying, hi, good evening. Good evening, can you be pregnant and still have your periods? No, that is abnormal. If you're pregnant, then you're not supposed to have periods. A pregnant woman doesn't undergo menstruation, except if there is a problem. A pregnant woman doesn't go under menstruation except if there is a problem. However, that may not be, you may see some blood when it is not menstruation. For example, you may be pregnant, maybe at 2 weeks. That is at 2 weeks, that is 14 days. You can see some light spotting, some bleeding, and that is called impartational bleeding. So someone may say, I am pregnant, but I'm seeing some blood. That is impartational bleeding. 2, you may have conditions like placenta previa or abruptio placenta. That is bleeding in pregnancy. So you can have some bleeding which is abnormal, but not menstruation. If it's menstruation, then there is something wrong we are talking about. So let's have, we've been answering questions on YouTube and we are still answering them. Let's just have one person on TikTok to go live and ask a question, and then we go back. So we are only having one person on TikTok. I don't know who that lucky person will be. The lucky person will go on live with me, and then we leave you guys of TikTok. Who asked first? Is it the person on the uppermost, the one that asked first, or? Okay, let me get this one, Princess. Okay. Then let me get another question here. Justin Nabil is saying, hello doc, why do I get breast tenderness after my ovulation until menstruation? It starts from day 16 up to day 28 of my cycle. Am I normal? NB, my cycle is 28 days. Yes, it is normal. This is what we call abnormally normal, being abnormally normal. Sometimes it happens, but it is as a result of hormonal fluctuation. Hello? Hello? Yes, good evening to you. How are you? Please be louder. We are not hearing you. Be very louder. If you're not louder, we shall take you off. Be loud. We are fine. So what's your question and where are you calling from? Sorry, we are going to lose you because you're low, your volume is low. Your volume is low, we cannot hear you. Let's have someone else. Hello?
Hello, sir. Can you hear me?
Yes, I can hear you. How are you? Where are you calling from? And what's your question? Be very loud and faster.
I said, what will somebody do to conceive twin baby boys, or any drug that the person will take to conceive baby boys?
Medicine is to use in order to conceive twins. Number one, you're going to use a medicine called tamoxifen, letrozole, or clomiphene. Those are medicines that can be used if someone wants to get twins. Now, twins on an ovulation day are likely to be twin boys. Twins on your ovulation day are likely, there are higher chances that twins, if you have sex on the ovulation day, you'll have a baby boy. Now, if you want twins, you're going to do what they call hyperstimulation, hyperovulation, okay? So it means you are going to swallow these medicines, the tamoxifen, the clomiphene, the letrozole I've talked about, but also swallowing those medicines depends when to start, depends on the length of your menstrual cycle. But those are the medicines you'll take. After taking them, have sex on the ovulation day, then there will be very high chances that you'll have twins and boys. Is that clear?
Okay, sir. Yes, sir. But which actual day would that person take? Is it after a period or the time of ovulation?
What is the length of your menstrual cycle? What's the length of your menstrual cycle?
It's 28, sir.
28 days. Take on the 3rd day for 5 days. Start taking the medicines on the 3rd day of your menstrual cycle. When you see periods like this today, that is day 1, day 2, day 3. On day 3, start taking those medicines I've told you for a period of 5 days. Then have sex on the ovulation day.
Okay, sir.
Is that okay?
That means 3 days of my 3 days of my period I should start taking the medication.
That what? On the yes, on day 3, that's when you start taking medications. Yes.
Okay, sir. Okay, sir. Thank you very much, sir.
All right. Thank you too, and have a nice time.
But problem is that I don't normally have one cycle. Sometimes I have 28. Sometimes I have 30.
Sometimes you have what and what?
Sometimes I have 28-day cycle. Like last month, I have 28-day cycle. The last 2 months, I have 30-day cycle.
20?
Next month that is coming.
Please, you said you sometimes have 28 and what? 30. So we said that if you have an irregular menstrual cycle, then you're supposed to use the shortest. That means you use 28.
Yes.
All right. All right. Nice time. Let's have some more questions on our YouTube. Someone on, okay, let's have questions on YouTube. Okay. Okay, there is a question here. Let's answer a question on TikTok. HTTPS menopause. You're saying if menopause woman can evaluate. What's the question? What's the question? I don't get your question. If menopause woman can evaluate, I really don't get your question clearly. What will someone do to conceive twins? I've already answered that. Hello, doctor. Or this one, doc, please, will someone do to conceive twin boys? I've already answered that. Belly button pain, I've answered. All right. So let's continue with our questions on YouTube. This one is saying, hello doc, why do I get breast tenderness every after my ovulation until, okay, I've answered this. Elizabeth Kilo is saying, my tummy is becoming big after my twin delivery. Why? The tummy became big after delivery. Yeah, remember, after twins, this is simple science. Do you really want me to answer that question? This is simple science. I mean simple logic. You had, it is simple logic. Come on. But let us see it. Let us see it here. After, when you conceive, I've always told you that your uterus, the size of your uterus is the size of your fist. Okay, so your uterus, the size of your uterus, if you're not pregnant, your uterus is of this size. So that means a normal uterus will be around this size. Okay? This will be the normal uterus. You see, we usually make it big, but it is small. So this is the normal size of the uterus when it is in your tummy. Okay? When it is in your abdomen. That's how big it will be. Okay? This is your uterus, like a pear. It is pear-shaped. Okay? Now, when you conceive, of course, as the baby grows, some of you give birth to babies of around 5 kilograms. You give birth to babies of 3 kilograms. Okay? So when you conceive, the uterus expands or enlarges because it's expansile. It has that expansile ability. The uterus is like the vagina. It also expands depending on the size of the instrument that is there. Yes, because if the instrument is small, the view will also be small. If the instrument becomes big, it will also enlarge. And when it gets used to big things, it will become big. So that is the same physics which is within in the uterine cavity. So it also expands as whatever is inside there expands. So now, when you have twin pregnancies, this uterus will enlarge. Okay? It will enlarge. It will enlarge and it comes to around this size. Eh? So when it is enlarging, it is also expanding the muscles of the abdomen. The abdominal wall is also expanding. That's how women end up with those stretch marks. Okay? In my language, they call it mugaba. They end up with stretch marks on their bellies. You've seen those stretch marks on your bellies. So they are as a result of the expansion, enlargement of the skin, muscles, and every structure around there. So when you give birth, some people, these structures don't go back to normal. Some of them will not go back to normal. And when they don't go back to their normal size, then that's when you'll have a big belly. So that is what happens exactly. You'll have a big belly. But of course, when someone gives birth, after giving birth, after 6 weeks or after 1 month and a half, there are some exercises, there are some maneuvers we give women and they retain their bellies. Okay? So after giving birth, after 6 weeks, after 6 weeks, there are some exercises, there are some maneuvers we can do. We usually advise those women to go for physiotherapy or to go for some other, you reduce some light somewhere. So they go for some other, they go for physics and so on, so that they can regain their normal bellies. So that is, I think I've answered that question clearly. Okay, Simusokoe Oswald is saying, Doc, what causes constipation? What causes constipation? This should be answered by you, my followers. But constipation is caused by eating hard food, okay? Coarse food. Eating food that is hard will cause constipation. Not taking water, okay? Some people do not want to take water. They only want to take juice and sodas. I asked one woman, what did water do to you? Is it the one that killed your grannies? Or they drowned? So you don't want to drink water because you may also drown. So water, some people do not want to drink enough water. They take hard food. You find people, they are taking popcorns, they are eating sandwich, they are those hard food stuffs, okay? And they are not taking enough water. That's how they end up with constipation. Okay, Destiny Child is saying, please doctor, after miscarriage, it's possible to get pregnant with seeing period. After miscarriage, yes, it is possible. I talked about it. Check in one of my videos, okay? Check in one of my videos where I talked about when to conceive after miscarriage. So after seeing at least one period cycle, then it is okay for you to conceive. Yeah, so it's very, very possible. I think we're about to leave TikTok, isn't it? Okay, we are left with 5 minutes. Those of you on TikTok, we are left with 5 minutes. So make sure that when we switch to YouTube, you go to YouTube and ask those questions. We shall complete everything from there. Okay, we have, this question is running away. I have been trying to conceive, the doctor, okay. Sorry, let me read this question, but it is running away and I don't want to skip someone's question. Okay. Please make a video on how to get peak day of ovulation. Please make a video on how to get peak day of ovulation. That video is there. There is a video about ovulation. There is a video. Check in one of my videos after this live. Check in one of my videos. I said signs of ovulation. It is there, very clear video. I explained everything. There is a clear video about the signs of ovulation. I think you should be able to check on it. It will give you a clear view of what you want to know. Glory Joy is saying, good evening, sir. Good evening to you. Scovia Nantongo is saying, hi, doctor. I did an HSG. It's now 2 weeks, but I don't know why I feel pain in my pelvic region, like wounds, and what can I do? Yes, sorry about that. Most women, after doing an HSG X-ray, they get that pain, and it is as a result of the pressure that is used when injecting that dye. Sometimes different radiographers or radiologists use that dye, and they use a lot of pressure when they're injecting it, and it can cause some inflammation somewhere, and you have pain. So what are you supposed to do? Get painkillers. Just go and get some good painkillers. There is a painkiller called Brustan. That is a very good drug. You can use a painkiller called Brustan. You can use Ibupa. You can use any other painkiller of your choice. It will help you. And that inflammation, if you take those medicines, probably 2 to 3 days, pain will go away. 52 pressure back. Okay. Emilia Sega, hello doctor, what is the cause of miscarriage? Oh, this is a very long topic. Causes of miscarriages. But I think I've also heard the video. Please go to my channel here and look for the video of causes of miscarriages. I talked about it. Causes of miscarriages, causes of abortions. I talked about those. But there are very many. If I'm to mention, can be infections, can be trauma. Trauma, what I mean by trauma, maybe you've fallen, you've had a fall, someone has beaten you, you're involved in a scuffle, you can have a miscarriage, you can have a hormonal imbalance, especially low levels of progesterone can cause miscarriages. You can have a miscarriage as a result of rhesus factor incompatibility when your blood group is negative and your husband is positive. All that can cause miscarriages. I've talked about infections and so on. Chromosome abnormalities, all those ones can cause miscarriages. But check out my video, it's there on my channel. Please, those of you who are watching this live for the very first time, do not forget to subscribe to our channel so that you can get a notification of the new videos we upload. We have very many videos teaching you. Some of these questions you're asking, I already made videos concerning those topics. So go there and ask questions of your choice. Then secondly, you can join, you can become a member of our YouTube channel. There is that button when you see on your screen which is saying join. You can join, become a subscribed member. You become a member of this channel. Benefits, ask those ones who have been members. I give them a live one-on-one video chat with them. They explain to me their problems, and we find a way. If we can hope, we hope. Yeah. So another question, this one is saying, Abubeka Aishat, I took Litrazole for ovulation and I saw egg white mucus. I took Litrazole for ovulation and I saw egg white mucus. All right, that is good. And had severe abdominal pain on day 13 and day 14. That means this medicine worked and you got ovulation. Yes. 13 and 14 of my cycle. But ovulation test strip shows weak positive. Does that mean I didn't ovulate? You ovulated. You ovulated. Though it may be weak, whatever it is, but you ovulated because you saw egg white. That is a very significant sign of ovulation. Egg white. When you see egg white and you're planning to conceive, just celebrate. That means you've ovulated. And remember, you ovulated on the 13th and the 14th day. If you're 28-day cycle, that means that was your ovulation day. So I have no doubt that you ovulated and those medicines helped you. Brenda Kabombeka, oh, this name. Brenda Kabombeka is saying, Doctor, I had a blighted ovum. I think we are getting off TikTok. Right now we are getting off TikTok. Please, everyone, go to YouTube and ask those questions you wanted to ask on TikTok. We are leaving you. I sign out on TikTok and we continue with YouTube. Go to Ask Dr. Uthman YouTube channel. The name is, it's Ask Dr. Uthman, and make sure that you subscribe and follow our live. Thank you. All right, so let's continue. Is it off? So let's continue with our questions live on YouTube. Let's get these guys of TikTok off, and then we concentrate here. Brenda Kabombeka is saying, Doctor, I had a blighted ovum and was aborted, all right? Then on my second period after the abortion, I used clomiphene this month correctly, and I met my husband on ovulation day, but I'm still not pregnant. Yeah, just give it some more time, Brenda. Come on. Yes, if you fail to conceive on the first in the first month after an abortion, you can wait. Come on, wait. Just give it another month and another month. Then we can now talk about it. If you fail in at least 3 months. So, Sally Banda is saying, good evening, Doc. Sally Banda, are you from Zambia? I think you're from Zambia. Sally Banda is saying, good evening, Doc. I was doing a renal test and scanning the entire abdomen and pelvic. What causes contractions all folding in the pelvic? I feel pain in the left of my pelvic. Sally Banda from Lusaka, Zambia. Yes, I knew. These names Banda and so on are from Zambia. Say hi to the Zambians. We had a comedian who asked, because then the president of Kenya was called Kenyatta, and asked who is the president of Zambia, and we thought the president of Zambia was Zambiata. So let's, your question, you're saying that you did a pelvic ultrasound scan, you did renal tests. Okay, yes. What causes contractions all folding in the pelvic? I feel pain in the left of my pelvic. All right. So pain in the pelvic region can be as a result of PID. Please, as you're investigating, investigate whether you have a PID. If the pain is in the pelvic region, especially if you're talking about the left pelvic region, it may be a PID, it may be a kidney disease. Kidney diseases can cause that. It can be a cyst. So check around a cyst, a kidney disease, a PID, or even something in the uterus. Any problem with the uterus can cause that pain. So I think do investigations around that. But the pelvic ultrasound scan should be able to show you if the kidney is injured, and even the renal test should be able to show you if it is injured. Then it should also be able to show you if we have any mass, any cyst in the pelvic region. Okay. Then don't forget to do a urinalysis, and also your doctor should do a bimanual vaginal examination. Okay. It tries to palpate there to find out if you also have a cervical motion tenderness. It may just be a PID that is causing problems with you. Brenda Kabombeka is saying, what can I do, or which medicine can I use to get pregnant first? Brenda Kabombeka, it's you who had a miscarriage 1 month ago. Then you used then you did what? Let me get your question up. You used the clomiphene, okay. So I think clomiphene can work. Clomiphene can work, though a better medicine is Litraz and tamoxifen. But even clomiphene can work. So try it in the next month. Still use the same drug in the next month. You'll conceive. J. Ibrahim is saying, I am called Eunice. I'm from Kenya, Nairobi. What caused Lack of appetite. My stomach every time is full and bring appetite, doctor. Your stomach is full. Sometimes fullness of the stomach can be caused by PUD, peptic ulcer disease, or gastritis. Those conditions to do with ulcers, okay, can cause abdominal fullness. And when someone has that has a lot of gas in the belly, in the stomach, you may have that feeling of fullness, like you are satisfied, like you're not hungry, and you may lose that appetite. So that can be an issue. Then secondly, you may be having an infection there. You may be having some typhoid and any infection there. But in most cases, it is as a result of gastritis, what some people call it PUD, gastritis, or what we call the ulcers. Okay, either duodenal or gastric ulcer. So check around that area. That's where the problem may be. Owalabi Omuwumi saying, you don't reply my own question. Where is your? I have answered Owalabi's question. I answered your question. Okay. I really, when I come here on live, I don't select questions like maybe let me answer only so and so. No, I answer everyone. I answer everyone except if I don't see your question or if it rushes away. That's when I may not answer, but I answer. I'm not selective, and I answer everyone's question except if time catches up, as that's when I go away. Janet Mwenda, when can I take my FSH and LH tests? Because a doctor told me to take these tests on my 21st day of my cycle. But when I went to see another doc, he told me I took it on a wrong day. I am confused. Now, it is true that there are some specific days we may want to do these tests. But it is also true that it confuses most women. And therefore, this is what I resorted to. Just do the test on any day. Because at the end of the day, each day you've done that test, each period, because we have the luteal phase, the follicular phase, we have the luteal phase, we have the ovulatory phase, the ovulation phase, and then some people can even say menstrual phase. So if we are interpreting the results, we shall interpret them depending on the day you did this test. So don't mind about the day. That is what I usually tell people. Go and do the test, but at the back of your mind, you should know when that test was done. You did it on which day? Was it the 21st day? First day? Then when you tell me the day you did the test, I can now calculate following that. I mean I can interpret the results. Following that, was it luteal phase? Because we have different reference ranges. Was it follicular phase? We have different reference ranges. Was it the ovulation phase, the peak ovulation? Then we also have the reference range for that. Age, depending also on your age. Is it, are you within are you in the menopause are you in menopause? Are you at around the perimenopausal period? Are you within the reproductive age, that fertile age? So we still interpret results depending on the day you took that test, also depending on your age. So take the test on any day, then they can be interpreted using those phases. Saibish is saying thank you very much. All right. Glory Joy, doctor, please, what is the cause of hormonal? What do you mean? Hormonal, what do you mean? What is the cause of hormonal? I don't get your question, Glory Joy. Saish Bisheti, you mean 10 day to 19 day are my ovulation day count? No. 10 to 19th day are not your ovulation day. They are your fertile days. Okay? They are your fertile days. They are days you can conceive. But we said on the 14th day, that is your ovulation day. So your ovulation day is 14th. Okay? But all the other days, 10 to 19, they are fertile. You can still conceive. But on the ovulation day, there are very higher chances of conceiving. I think we are clear. Blessing Ebiri. Blessing Ebiri is saying, I see my menstrual cycle on September 5th, and I didn't see again till today. I started seeing it small. What is the cause and what should I do? Blessing ability, you're likely to be having a hormonal imbalance, okay? You're likely to be having a hormonal imbalance because I always see your questions are they are rotating around hormonal fluctuation. So you're likely to be having a hormonal imbalance. Blessing ability, kindly go and do for me these two tests only. Number one, go and do for me an ultrasound scan. Let's rule out the fibroids, okay? Let's rule out fibroids and any uterine abnormality. Then number two, you go and do for me the fertility hormones. Do FSH, LH, prolactin, estradiol, progesterone, and AMH. Go and do for me those tests. They are likely to be abnormal. Then you'll get to know, you'll get the answer. Dorini Tindimwewa is saying, what can be done to reduce belly fat that comes or as a result of a C-section? Belly fat, Tindewa, you can use, you can do what they call, you can do exercises, okay? There are some abdominal exercises. We can do those stretches. They are there. I don't know, I think I should have a video on that. Okay, there are some exercises that can be done, and also dietary changes can be followed, and then you reduce that fat belly. But I don't advise people to take those slimming pills, okay? I don't advise people to take those medicines, those pills that reduce the weight, the belly fat, and so on. I don't ever advise them. I usually tell them to first use the non-pharmacological methods, and then if it fails, that's when they can go for them. Princess Grace, please, I will need your number. Oh, Princess Grace, I don't give out my number. Sorry, I don't give out my number. If I give out my number like this today, people will pump me with calls, WhatsApp messages, and I will not be able to work in the hospital. Therefore, I don't give out my WhatsApp number. But in case you want to have, I know you might want a private chat, to chat with me privately, just go to my website, www.druthman.com, book an appointment, then I will be able to chat with you. So I've put for you that website there, and it is also running on our screen. You can see that website, www.druthman, book an appointment, we talk. But for giving a phone number, please, sorry, I may not give it to you, because I have very many people, and you people will disturb me. It's not disturbing, but remember, I work also. I have to attend to patients physically. Grace Mwenyango is saying, good evening, doctor. My progesterone was checked and it was 0.452. Is it normal? I don't know, because you've not given me the reference ranges. First of all, we've said when you're taking fertility hormones, you note the day you've taken this test. So when I'm interpreting the results, or when we are interpreting the results, we use the day, the phase. At what phase did you take this test? At what phase of your menstruation did you take this test? 2, even your age. And then also the machine, the equipment that has been used to do this test may have some different reference ranges. Therefore, I can't interpret them very well if you don't give me the reference ranges of that machine, and also tell me the day you did the test. Elizabeth Favor, hi doc, my cycle was 27 to 33 days, but now it changed. It can go up to 46 days. What could be the problem? This is an abnormal menstrual cycle. It is very abnormal, and you are likely to be having a problem with your progesterone or prolactin. So this is a hormonal issue. So the problem is hormonal imbalance, full stop. Fagiba Mira Bukola is saying, after using Cabergoline, yes. Now these are the people I want who have already followed some advice from me. After using Cabergoline and the prolactin level has been normalized. Thank you, that is very good. Thanks so much to Cabergoline. I've always told the people here that Cabergoline will normalize your prolactin levels. Good? After taking Cabergoline and the prolactin levels have been normalized, okay? Can the prolactin still be high again after I have stopped the drug? Yeah, after a certain period of time, it can still go high. It can still go high, especially if the cause still exists. It can go high, but this takes at least some good period. Yeah, so this is very good. It's a good feedback. Then Princess Grace, you're saying, doctor, ever since I removed my IUD for the past 3 months, my bill is big, will cause it all might be pregnant. Oh, Princess Grace, I don't understand your question. Your English is not very well Englishing. Please correct it clearly, and then I answer you. Abu Bekar Aishat is saying, I was lactating, okay, yes. I was lactating and diagnosed with high prolactin. And the doctor prescribed Sinago, and I took it, but my breast is still producing water. Once I force it, my hormone are normal. Should I keep taking the drug? First of all, if you're talking about if you're lactating, now I think I am seeing something wrong here. When you are lactating, a lactating woman means a woman who is breastfeeding. If you're breastfeeding, we expect prolactin to be high. So you don't need to take a medicine. You don't need to take Kabagol. You don't need to take any medicine for high prolactin levels, yet you are breastfeeding. It's a mistake. You can't take medicines to reduce breast milk, yet you are breastfeeding. I said double standard here. So in the first place, you are not supposed to even do the test of prolactin level. Why should you do the test when you're breastfeeding? You have enough breast milk. Why should you do the test? 2, you did the test and found that it is high. Yes, it was supposed to be high, and it is normal to be high when you're breastfeeding. So you took the medicine, and so I really, I don't get you clearly, but that's it. When you're breastfeeding, why should you take the test if you're having enough breast milk? This one is saying, Fagibamira Bukola is saying, please, what is the way out of heart pain and vaginal dryness after using Clomid? No, Clomid doesn't cause vaginal dryness and doesn't cause heart pain. Those are not side effects of clomiphene. If you have heart pain, then that is a cardiovascular problem. It's a problem with the heart, which needs to be investigated by a cardiologist clearly. That is the cardiologist's work. About vaginal dryness, it is not as a result of using Clomid. What can cause vaginal dryness is low levels of estrogen hormone in blood and several other factors like infections and so on. Check around that area. Queen Beauty, please doctor, I take medications to bleed, and please doctor, I take medications to bleed, and when OS my ovulation day? Please doctor, I take medications to bleed, and when is my ovulation day? Queen Beauty, I cannot know your ovulation day when I don't know the length of your menstrual cycle. I can't know. So tell me the length of your menstrual cycle. I'll tell you ovulation day. Blessing ability, what should I take to boost my ovulation? Ovulation is boosted by luteinizing hormone and FSH drugs. So therefore, you can take medicines containing FSH and LH. For example, Litrazole, Menapa, tamoxifen, clomiphene, and so on. Those ones can boost your ovulation. Cassie Edwards, hi, good day, doc. I'm having mild cramping. It's different from the period. Hi, doc. Hi, good day, doc. I am having mild cramping. It's different from the period pain I usually have. Could it be I have conceived this time around? It is possible. It is possible. Just carry out the test and find out if so. Cassie Edwards, okay, yeah. Makweniti Miss Gunn is saying, hi doctor, my wife FSH is 20.79, LH is 3, and prolactin is 11.1. Is it good to get pregnant? This is the same thing. We cannot interpret fertility hormonal results when we don't have reference ranges. Give us the reference ranges and the day your woman took the test. Queenie Beauty, please doctor, I take medication to bleed. When is my ovulation day? I don't know. I said we cannot know the day you had ovulation when you'll have ovulation when we don't know the length of your menstrual cycle. Another one is saying, please doctor, I take all right. Fagibela Bukola is saying, have used Clomid for 2 cycles. I have been using ovulation prediction kit to test FSH and LH, but I didn't ovulation throughout the 2 cycles. Please, should I do ovulate or should I stop Clomid? Now, first of all, I would ask you to go and do fertility hormones. Find out, yes, you're using FSH and LH medications, but is the problem FSH and LH? First, do tests and find out if you have low levels of FSH or LH. If you find so, then you can take these medicines, or we can change other medicines. Okay? Yeah, we can change. You can tell me the medicine you've been using, and then we change to a different drug. Okay? But let's be sure that you did tests. Our time is running up. How many minutes are we left with? Oh, our time is running up. We are giving ourselves only 5 minutes. Only 5 minutes. We answer and go away. Our time is running up. I think I'm likely to stop here. So, can you get miscarriage without bleeding? There is what they call a missed abortion. A missed abortion is also like a miscarriage, and it can happen without bleeding. But at the end of the day, you will still bleed in order for the fetus to get out. Yeah, that can be it can be found out on a scan. The fetus will be found there, but it is not growing. That is also called a missed abortion, and then which will not have bleeding. But of course, the fetus will be there on the scan. I think we are time bad. We are running away. And please, I may not answer all these questions. This one is saying, Nakamanya Hajara, thanks Doc for the show. Thank you so much, Nakamanya Hajara, for appreciating. Blessing Ebiri, I think this may be. If you see menstrual cycle 3 days before 28-day cycle, or 3 days after ovulation cycle, is it irregular? It is irregular, of course. That is an irregular cycle. Oh, I think I will have to say goodbye to everyone. Let me first answer this last one. Very last question. This is the last question. Good evening, doctor. I am God's way from Ghana. Okay? Please, what is the way out of a person with submucosal fibroid? Hey, this is the last question indeed. Let me answer this one and we go away. Please, what is the way out of a person with submucosal fibroid bracket myoma during pregnancy? Please, I am in pain. 5 months. I go to the hospital in pain. Now let me tell you. If you have a fibroid and you are pregnant, it is a big dilemma. These are some of the medical dilemmas we talk about, obstetric dilemmas. Because number one, you want that baby. And we also know that if you lose this pregnancy, it may be very difficult, it may be hard to conceive if you have that fibroid. Therefore, we look at many factors. We look at the size of this fibroid vis-a-vis the pregnancy, the gestation age. But in most cases, we shall just be giving painkillers, giving you some progesterone medicines to try a little bit to shrink the fibroid, to also reduce its size, but also trying to maintain that fetus there. Of course, if pain persists and it is too much unbearable, then we shall have no option but removing that baby or having a miscarriage and so on. But we would advise to persevere. You get painkillers, progesterone supplements, etc. until you reach term. At 37 weeks, the baby can be taken out and also the fibroid removed. If it is your very first time to watch this live or to watch my videos, please do not forget to subscribe so that you can watch many videos. And I tell you, most of you, the questions that you're putting here, trust me, some of those questions I are already answered. You check in the list of my videos, you'll find those questions. Listen to those videos, then you'll get your question answered. I'm telling you, most of these questions I'm seeing here that I've not answered because of time, please go to the channel, find those videos there. There you'll get the answers to those questions. We shall have another live next week on Thursday, same time. Keep that time. And if you would like to have a private chat, a private conversation, to talk to me directly, privately, go to my website, www.druthman.com, and book an appointment. Then we discuss. That website is passing down there. And those of you that have issues with their phones, you have those of you want to use to do YouTube, those of you who have problems with your machines and so on, please go to a YouTube channel called it.next. It is managed by the man himself behind the camera here. Mr. Kesberg is an IT expert. He's an IT specialist, actually. He's a specialist in these things. Go to his channel. It's called it.next. it.next. So that it.next, I've written that name there in the comment. it.next. Go to the YouTube, subscribe, and watch his videos. Ask him many questions the way you ask me questions concerning reproductive health, because you do trust me that I can solve your issues regarding your health, reproductive health. So also go to his channel and check out the videos. He's the guy behind these beautiful pictures you're seeing, the lights, everything. And he is also very good. He can help you if you have any problem with your phone, internet, whatever. You want to connect this Wi-Fi, cameras, you want CCTV cameras, everything. Kesberg at it.next is the man. I sign out. Good night.